Hi ladies! I want to welcome you to the first ever live anti-aging skincare webinar sponsored by Neutrogena and TotalBeauty.com. I'm beauty blogger Nadine Jolie and I'm very excited to be your host today. Joining me is celebrity dermatologist Dr. Will Kirby. Dr. Kirby is a board-certified dermatologist from Beverly Hills, California, and you might recognize him from shows like Dr. 90210 and Live with Regis and Kelly. Dr. Kirby, a lot of viewers are wondering how skin ages. Can you explain that?
Yeah, absolutely. I think that's a great place to start, actually. There's really two ways that we talk about skin aging, and one of those ways is intrinsically, and that's what's occurring internally in your body.
Okay.
And that's really associated with normal biological functions, hormones, and just the aging process. Unfortunately, there's not a lot you can do about that.
Okay.
Now, I know you're sad about it, I'm sad
like
about it.
that.
But the good news is extrinsic factors and extrinsic aging, you could really make a big difference with. So when we talk about extrinsic factors, those are the things that are occurring in your environment. Sunlight in particular is absolutely a terrible extrinsic aging factor, as well as smoke and environmental toxins.
Right, of course.
So maybe we could pull up the first slide actually and show a couple pictures. If you look at healthy protected skin, it's really well organized. You have thick collagen bundles, a really nice epidermis. As you, when you talk about intrinsic aging, well, of course that epidermis thins over time and you lose some of that collagen. But then if you look at the third picture in our set here, it looks like a mess. And why is that? Because of the extrinsic or the external aging process that's occurred.
Okay, okay. So I understand that various functions deteriorate over time, but what actually happens to trigger the aging process?
Well, it's a function of cumulative damage. So there's antioxidation, which is a huge problem, and it's just a function of.
Wait, and what is antioxidation?
I'm sorry, I get ahead, sorry, I'm a nerd. I get ahead of myself here. But what happens is with those external problems, you really have I'll break it down as simply as I can. Free radicals or sort of foreign invaders come in, break down your DNA, damage those cells, and they make the cells really appear very unattractive. And what happens, what does that mean for you? Well, it means you develop the clinical signs of aging. You get mottled skin, you get thin skin, you get fine lines, you get deep wrinkles, you get uneven texture and uneven tone. And so those are the things that unfortunately society deems to be unattractive. And those are the things that you really can take an active fight against in your life.
Okay, and so I know that retinol is, a big ingredient for aging. Can you explain how it works to address anti-aging?
Absolutely, I'm in love with retinol. There's no secret there. I actually have a love affair with retinol. I'm the least hypocritical dermatologist you'll ever meet. I use retinol every single night. If you come to my home and open the medicine cabinet, there's retinol in there. And why do I love retinol? It's not just me. Ask any board-certified dermatologist. Study after study after study has shown that retinol is the gold standard in the anti-aging market.
Yeah, doctors love retinol.
And for years, but all retinols are not created equal, and I think that's very, very important to emphasize here. So doctors love retinols, but it's really a function of buying a stabilized retinol and using that product appropriately.
Okay, now don't we have a great before and after?
Yeah, let's pull that up. What happens when you use a retinol appropriately? Well, let's look at this picture on the left and on the right. After 12 weeks of retinol use, what do you see? Look at the cheeks, just jump right to that area. You get a great improvement in the appearance of those fine lines and wrinkles. But overall, the tone looks healthier. You get restored luminosity, improvement in luster, improvement in humectancy, and a better tone, better texture. Just overall, some of those external signs of aging have been improved significantly with just a few weeks of retinol use.
Yeah, I can see a really big difference. But doesn't retinol, I know it's effective, as you were just saying, but doesn't it cause redness and irritation?
I'm so glad you brought that up. That's a very common misconception. When we talk about retinols not being created equal, if you use a retinol aldehyde or retinol palmitate or pro-retinol, if you use an inferior retinol product, you can develop some irritation. Now, a lot of times it's a function of people using their products inappropriately. They put too much retinol on because they want a very fast result. And
more better?
They think more is better, and that's actually not the case. Using an appropriate amount of a stabilized retinol is the single best thing you can do to really fight those signs of extrinsic or external aging.
Okay. I mean, I myself actually use the Neutrogena retinol products, and I love them. Yeah. But I know that didn't they recently come out with a new line that's very fast?
Neutrogena is perpetually reinventing themselves, and their research and development team is so incredibly strong. Rapid Wrinkle Repair is the name of their new product. It works in as fast as 1 week. Why?
Wow.
It has stabilized retinol. If you've ever heard me speak in the past, I love stabilized retinol. It's the highest quality ingredient you can get. But this also has myrtus leaf extract. And what does that do? It's a great moisturizer. It really drives that retinol in, allows you to tolerate it very well, and it makes it the clinical appearance, those clinical improvements, that anti-aging fight begins much more rapidly. So it occurs very quickly, within as fast as 1 week.
Okay, great. So thank you for answering those questions.
Oh, sure.
We're actually going to take some questions now from our live viewers.
Let's
so
do
if
it.
you guys can start sending those in.
Before we even start with those questions, I always tell people the word doctor is derived from the word doctorate, which means to teach. So I love to teach. I hope people email in with a lot of questions. Nothing is off the books. Any questions you have about the aging process, please feel free to blog in.
It looks like we actually already have a question. Okay, I feel like I have too many skincare products and am confused by what is needed for AM and PM.
This is one of my pet peeves because there's so much confusion out there, and I absolutely hate it that our industry has made it so difficult to understand. If you make an appointment at my office, my staff will tell you before you come in, Dr. Kirby wants to see what you're using. I am not kidding, Nadine. People will literally come in with a sack of products and they dump them out on the counter and they spill everywhere. And I tell them, you do not have to make this confusing. You do not have to make this a difficult process. And one tip I give them is please do this. Go to your medicine cabinet tonight and organize it. And what I want you to do, ironically, I want you to take the products that you don't use and I want you to turn them around backwards so that the label is pointing out. And at the end of 30 days, any product you've used during that time, I want you to make sure that you're pointing the front of the label out toward you. And if you understand that, what I'm saying here is at the end of the month, any product that's backwards, you're not using it. Why? Because you're not needing it. You don't want it. It's not working for you. Throw those in the garbage and just stick with the products that are working for you. And your regime can be very, very simple. Broad spectrum sunscreen every single day with Helioplex.
Okay.
Stabilized retinol every single night. Start simple and keep it simple.
Okay, all right, so sunscreen in the morning and then retinol at night.
Absolutely.
Okay. Another question we have. I saw a product that had pro-retinol in it. Is that the same as retinol?
Great question. I alluded to this earlier. All retinols are not created equal, and it's absolutely imperative that you're using a stabilized retinol product. You want the efficacy or the effect of that product to work the same day on day 1 as it does on day 30, as it does on day 60. So you use a tiny little bit every single night, but in the retinol world, you get what you pay for, and using a high-quality product is really going to make a big difference. It's going to make a difference in your skin that your friends notice, that you can see in the mirror yourself. So I really appreciate that high-quality ingredient because I can see it in my own skin.
Okay. And I know, we have another question.
Sure.
Can men use the women's products?
Absolutely. I mean, the truth is men don't really like going to the dermatologist, and that's really changing very rapidly. Even in the course of my short career, in the last few years, I've seen many more male patients come in, and men are much more concerned about the anti-aging process. There's a great men's line from Neutrogena, but men can absolutely use female products as well.
Okay, good. Another question. Okay, can you overdo the anti-aging regimen? Can we overclean, overtreat skin?
Of course, people are perpetually trying to do too much, and they have too many products, and they don't really understand how to use their products, and they're just piling more and more on, and they're really taking steps backwards.
Right.
Your regime or your routine does not have to be difficult. It can be incredibly simple, and a pearl-sized amount of that retinol every single night is really the foundation for that anti-aging fight.
Okay, so as you were saying, more is not always
better.
More
is not better.
Okay.
You'll hear me say this over and over. Pearl-sized amount, pearl-sized amount, pearl-sized amount. People want to put a big dollop, or they want to goop it up all over their face, and that is taking a step backwards. You don't need to do that. You need to be patient and use the appropriate amount.
Okay, and then what about the delicate area around the eyes?
The eye is some of the thinnest skin on the entire human body. And why is that? Well, because of both intrinsic and extrinsic aging. You get a very thin epidermis there and you lose collagen over time. So the eye is incredibly sensitive. And it's not just a cliche. People say it's the gateway to the soul. You can really see someone's age in their eyes. That's very, very factual. So using great sun protection around the eye in the form of dark sunglasses and sunscreen is imperative during the day, but using a little bit of retinol at night is really important as well.
Okay. Another question just coming in. It says, what do you recommend as a solution to large pores?
Well, large pores are a constant problem, and the reason is your body's perpetually producing sebum, which is the medical term for oil.
Okay.
And no matter what, your body is producing more and more and more every single day. So you need something that's going to increase surface cell turnover, that's going to diminish the look of this pore size. So retinol, ironically, is also one of the best ingredients you can use to minimize pore size. So retinol has it's a derivative of vitamin A. It comes from vitamin A. It's a very, very natural product actually, and it has a ton of phenomenal anti-aging benefits.
Okay. Another question. Here we go. Are using serums before your other moisturizing products really necessary?
This is a great question. It really leads back to one of those first questions we asked: is what should I do in my regime? And people really want to overcomplicate their regimes. Serums are very, very thin.
Okay.
And serums are often easily spread, and as a result, I really like serums to be the first thing that comes in contact with your skin.
Okay.
Now, this is really a two-part question because it says, when should I use my moisturizing product? Not everyone needs a moisturizer. If you have large pores, you probably have oilier skin, and you probably don't need a moisturizer. And that's very true for men. It's also very true for certain areas of the face. For instance, the nose often has very large pores. It's very sebaceous. It has those oil glands. It usually is not prone to dryness, and you might not need a moisturizer in that area. Moreover, you may only need a moisturizer during certain times of the year. So if you need a moisturizer, there's no harm in using that at all, but you don't necessarily need one depending on your environment and who you are.
So you're saying certain times of the year. Does that mean that maybe in the summer, some people aren't going to need?
Yeah, absolutely. If you live in a humid environment during the summer, the humidity level rises, then you may not need a moisturizer at all. But if you live during the winter, if it's very, very dry and you're indoors a lot, then you may need a moisturizer during that time of year.
Okay.
But that shouldn't change your underlying regime. Your underlying regime is still the same no matter what. Broad spectrum sunscreen every single day. Broad spectrum meaning it blocks both UVA and UVB, which are the photo damaging rays of light.
Okay.
But also using that retinol every single night.
Okay. Another question. There are so many products out on the market for anti-aging. How do you choose which product is right for you?
You know, the thing is, like I mentioned this earlier, I'm the least hypocritical dermatologist you'll ever meet. I am a huge proponent of Neutrogena products because they work very well for me. It's what I recommend for my own family. And I think that Neutrogena has a great track record. #1 dermatologist recommended brand of sunscreens.
Really? Okay.
And just last month in the men's department is #1 moisturizer for men. So Neutrogena has a great track record. Why wouldn't you go with someone that you trust and know?
And what age do you recommend people start, taking care of their skin with anti-aging?
I really recommend retinol begins at age 18. And some people say, well, I don't have any wrinkles at all
really
at 18.
Young.
Well,
yeah.
it actually isn't at all because you're still fighting those extrinsic factors.
Right,
so the
okay.
internal is going on every single day no matter what. But retinol works prophylactically, meaning it starts that fight before you even know there's a need for it. So you can prevent those fine lines and prevent that loss of luster in your skin by using retinol at a very early age.
Okay.
And if you come to my office, I tell people at the age of 18, I really recommend retinol. Now, there's a step before that, and that's the sunscreen. And you really need to use that broad spectrum sunscreen, blocking those damaging photo rays, even in younger children.
And so for people that maybe didn't get on the sunscreen bandwagon until later in life, can they still fight
Of course. Common misconception that all of your sun damage occurs before 18. That is absolutely not true. Every single day you are experiencing more and more photo damage, so it's imperative that no matter what your age is, you're using sunscreen.
And photo damage, that's the sun damage?
Exactly. Photo damage is damage from the sun, which is probably the biggest offender. It's probably your biggest enemy in that fight against the aging process.
Okay. Another question. Does the new Neutrogena product help with sagging skin? Does it firm the skin?
Well, I tell people there's obviously a common sense with any topical product. If you have sort of those hangdog cheeks and you need a facelift, well then it might be time to have that honest conversation with yourself. But it absolutely firms, tightens, and restores elasticity. That's what retinols do. And once again, don't just take my word for it. Google it, look up retinols, tried and true ingredient in a long-standing history of anti-aging products. So retinols are absolutely phenomenal, but if you have those deep sagging skin, or maybe you lost a tremendous amount of weight and you have a lot of hanging skin on the face, you may need more of a surgical procedure.
Oh, really? Okay, so I didn't realize that losing weight could actually make
yeah, absolutely. A lot of times if someone experiences significant weight loss, they'll actually say that their body looks a whole lot better, but that their face actually looks worse because they develop more sagging of the skin.
Okay.
So those people should really, during the course of that weight loss program, start that fight ahead of time and really incorporate retinol into their routine.
Okay. Another question. Is it really possible to substantially increase or stimulate collagen production?
100%. That's an amazing question. I don't know if we can pull it up, but can we go back to the very first set of photographs? I don't know if it's too late, but we have some photographs here, and if you look at where is the collagen bundles, those bundles are in the dermal layer of the skin. And that dermal layer of the skin, it has the elastin, it has the fibroblasts, they're building that collagen. What does retinol do? Penetrates through the epidermis, and it stimulates collagen growth. And it's one of the few products that really does that.
Okay. Now let's go back to our questions and see. So what do you think some of the biggest mistakes women make with their skincare routine?
I think really, like we alluded to, I think people overcomplicate it. And people also fall under the category of just listening to their friends. And your friends, you're probably sitting in a room right now with your friends and they're a great source of information, but you also have to take it with a grain of salt. You ladies know what I'm talking about. You have to be careful because you have that one friend, probably in the room with you right now, who has 55 products and you're not sure which one's working.
Right.
So get your routine very, very simple. Sunscreen every single day, retinol at night. You can always add more, you can always add to it, but that's the foundation of any anti-aging regime.
I love that you keep repeating that because I think that's really important. Sunscreen in the morning and then retinol at night.
I think people really, the problem is it's not exotic, and people want to do expensive procedures, and they want these lasers, and they want, creams that are derived from a berry found in the Amazon jungle, and I tell them, guys, slow down here. Let's look at the medical research. That's what I do as a clinician, as a board-certified dermatologist. I'm a scientist at heart. I look at the ingredients that actually work. Research and development goes into any good quality product, and clinical studies will always verify when a product works. So if something sounds too good to be true, it probably is, and you go back to basics and you use a product that has those core ingredients that will give you a big difference in your own routine.
Okay, good to know. Another question, what kind of anti-aging ingredients do you recommend for someone in their late 20s who hasn't quite seen the major signs of aging yet?
So this is really a repeat of what we saw before, and the analogy I make in this case is how do you stop a car? Well, your answer is that you put your foot on the brake, but the truth is you have to first take your foot off the gas. Okay. So if you're a 20-year-old, well, what do? You want to prevent those signs of extrinsic damage. So protection. Use that broad spectrum sunscreen every single day, which blocks UVA and UVB, preferably with Helioplex technology. And at night, start with that retinol. Why? That retinol increases that surface cell turnover. It continuously renews the look of your skin. So that process that's already occurring naturally, that epidermal turnover, those cells that are growing up from your epidermis and sloughing off, that retinol increases that process. So what does it do? It removes the signs of sun damaging, and it prevents the signs of sun damage. Fine lines, wrinkles, discoloration, loss of tone and texture.
Okay, great. Another question we have, can I use eye cream on my eyelids?
Well, eye cream? Of course you can use eye cream on your eyelids. You mean a retinol-based eye cream, I'm assuming is the question?
Not sure.
Well, let's talk about that.
I know, I'm actually confused because I've heard that you're only supposed to put eye cream, I guess, on the bottom.
You do have to be very careful, and this really comes down to a function of the amount of product you're using.
Okay.
A retinol-based product on the eyelid is a phenomenal idea, but it really comes down to the amount. If you're using a pearl size amount, the size of a pearl for your entire face, then you can imagine how little you're using around the eyelids, which is just an incredibly tiny amount. With any amount of retinol, particularly the low quality retinols, if you use too much of it, you're going to get redness, irritation, flaky, peely.
Right.
So as a result, if you use those same poor quality ingredients on the eye, it will be even compounded because that skin is so thin around the eye. So
that makes
caution
sense.
Around the eye, but it's still human skin, and you can absolutely treat it that exact same way as long as you're being very careful with it.
Good to know. Another question, is it best to use a set of products to get the maximum benefit, or does, say, an anti-aging cream's efficacy remain the same regardless of other products used?
Well, the truth is a lot of the companies create sets of products because the products really work together very well hand in hand.
Okay.
So as a general rule, I like the idea of using sets of products, but by the same token, as you've heard me say over and over and over, I'm a huge proponent of keeping things very, very simple.
Right.
So even though you may use multiple products from one manufacturer, that does not mean that you need to use 20 or 30 products. Your medicine cabinet should have your toothbrush in it, some deodorant, and it should have a few products. You should not have multiple products in there. That's just going to add to confusion, and it's just going to hurt your pocketbook.
Okay. Question, do I need a special cream for my neck, or can I use my face cream?
Well, there's a couple areas of the body that really respond a little bit differently. And there's particularly the neck, the upper chest in the woman, the décolletage area, and the back of the hands. They get a ton of damage. Why? Extrinsic photo damage. If you look at what men wear, very rarely are men exposing the top of their chest, whereas women's outfits almost always expose the top of their chest. So over and over and over, that thin skin is being beaten upon by the rays of the sun.
Right.
So in those areas, using a thicker cream that's really tailored for those areas, you'll get a better result. But it's also a function of protecting them.
Okay. Is there a product or ingredient to actually slow oil production? I use benzoyl peroxide and oil-free moisturizer and have tried a number of combinations, but no matter what I use, I'm literally dripping oil within 2 hours.
I'm going to overstep my boundaries here and take a guess as to what this person's doing. And my guess is that they're using too many products and overstimulating those oil glands because they're obsessed with cleaning.
Right. Okay.
So what happens is people like to use an astringent, and they use a toner, and they use a buff puff, and they use and they get a microdermabrasion, and they use all these things because they want to get rid of that oil. But what does that do? it stimulates the oil glands, it stimulates sebum production. And once again, this is why I'm a huge proponent of keeping things simple.
Right, okay.
So this person specifically referenced benzoyl peroxide. Well, benzoyl peroxide kills bacteria, but it's not going to help with oil a whole lot. And
really?
I really think, not knowing that person personally, I really think that's a perfect example of someone who's using too many products, overstimulating those oil glands, and needs to take a step back. And what is a great drying ingredient that helps with acne, that helps with the aging process? Retinol.
Okay.
Why? Because
ding,
it
ding,
increases the surface cell turnover, helps remove that oil from those sebum glands, and really will help with that excess oil production.
Right, okay. If I'm already using a prescription cream that has retinol to treat acne, should I only stick to that, or can I also spot treat breakouts with an over-the-counter spot treatment? Will that help? This is for me too, I need to know that.
This is a great question. Retinols are very well established for being great anti-acne ingredients.
Right.
The problem is by the time you see a zit, it's too late.
Okay.
Because that takes weeks and weeks and weeks to come up. So if you're trying to spot treat a zit, you may help it a little bit, but the truth is you're probably not helping it a whole lot, and you really have to prevent those in the first place. So you should probably stick with your prescription product and use it over your entire face, so that you can minimize or prevent those acne blemishes before they even come to the surface at all.
Okay. Let's see. Product claims usually say when to expect results, but they seldom, if ever, say how long to continue using the product. If results are achieved, must products continue as a lifetime investment, or if you stop, are the results reversed?
This is a great question. It really depends on how long you're using the product. When you once again, we keep going back to retinol, but I use retinol every single night, and I've been using it for years and years and years. If I stopped using retinol, it's not like all of a sudden time would reverse and I would look 10 years older than I look right now. What would happen is those external factors that cause the aging process,
pollution and smoking,
exactly,
and all that, right?
Those things would slowly creep back onto me. But because I'm constantly using the product, and it's also, when you use the phrase constantly using the product, it sounds difficult. It's actually very, very simple. But you do need to continuously use a product like a retinol every single night. And you probably heard me say the phrase earlier, compliance is imperative. And what that means is very simple. You have to stick with your regime. You can't jump around. You can't use this for 2 days, and this for 3 days, and this on Wednesdays, and this on, Groundhog Day. You have to stick with it tiny little bit every single night. Long-term results will make a big difference. This is an analogy I make to people in my office. If you at home have an identical twin, and you used products like broad spectrum sunscreen and retinols at night, and you really did a great job of fighting those extrinsic aging factors, and your twin did not, as you aged, you would look significantly younger than your identical twin. Now, you both have the exact same biology, you have the same genes, the same hormones, but you're fighting that extrinsic fight, and they're not. So you would appear younger over time.
So those extra factors are really going to contribute that much more.
100%. Okay. 100%.
Okay. Good question. Is exfoliating safe for acne-prone skin?
Well, the answer to that really depends. And the acne is really such a conundrum for everybody because there's multiple types of acne. And young women in particular have a lot of acne, and they really, I break it into a couple categories. There's blackheads, that's acne. There's whiteheads, that's acne. And then there's cystic acne.
Right.
Cystic acne is internal. That's an intrinsic problem. It's based on hormones. Blackheads and whiteheads is an extrinsic problem. And that you can really, really treat with topical medications.
Okay.
Intrinsic problems, they're very difficult to improve, and you often have to take internal medications to make a big difference there. So I didn't do a great job answering that question. It depends on what type of acne you have to determine if exfoliation is a good idea. If you're a teenage boy and you wake up with a lot of whiteheads, then exfoliation is probably a very good idea. If your problem is blackheads, then you may be overstimulating the oil glands by exfoliating, and as a result, you're going to get more blackheads. So you have to be very, very careful, and you really should probably consult a dermatologist and ask them what they think in particular.
Okay, yeah, talk to your dermatologist. Do the new Neutrogena products help a woman who is 69 years old?
Of course. 69 years old. I mean, my mother-in-law uses Neutrogena products, but also 69 is very, very young. This is actually, people now are living 90s, 100, someone just died who was 114. I mean, 69 is actually a very young age. So when do these extrinsic aging things occur? All the time. The intrinsic you can't do a whole lot about with that aging process, that chronological, biological process. But the extrinsic, at the age of 69, you're implying that you should give up. That's when the fight really starts. I mean, I think you have a good 20, 30, 40 more years of fight against the extrinsic products there. So absolutely you should use them.
Another question. Oh, this is a little more internal. Okay, what are the best foods to eat that can help prevent aging before it starts?
This is a phenomenal question, and it's really an area of huge debate. And a lot of people differ on this. And the thing is, I'm going to answer this as best I can by using my own personal analogies.
Okay.
If you're using broad spectrum sunscreen and you're doing a great job of avoiding that photo damage, that sun damage, then you may not be getting a normal amount of vitamin D. And as a result, why? Because your body produces vitamin D by exposure to the sun. But the best way to get your vitamin D is through a healthy, balanced diet. So there are certain things that you have to be careful about in the aging process to make sure you're getting enough of, particularly vitamin D.
Okay.
Now, we also talked about the oxidation process and using antioxidants. Theoretically, if you eat a diet high in antioxidants, salmon, omega-3 fatty acids, blueberries, blackberries, things like that, then possibly, slowly over time, you're going to have less of an oxidative process and less of an aging process from an extrinsic standpoint.
Okay, so you're saying that those certain foods will help you to fight the...
Possibly. Well, the science is still out on that. It's not, once again, let's go back to the identical twin analogy here. If you had an identical twin who ate salmon and blueberries every single day and you did not, I cannot tell you in good conscience how much a difference that would make. Is it a great idea? Absolutely. Having a healthy diet is absolutely a great idea. But what is probably going to be a bigger factor is avoiding those extrinsic factors, particularly the sun. If you're avoiding the sun, if your twin ate the blueberries and you avoided the sun, my suspicion is that you would look younger over time.
Okay. Let's see, another question. Is it okay to use other products along with the Neutrogena system?
Of course. A lot of products work together. Some people come to me and they say, Dr. Kirby, I absolutely love my routine. It works for me great. I just want to kick my anti-aging fight into a high gear. And I say, great, you can simply incorporate a stabilized retinol. Other people come to me and they say, I have no idea where to start. I don't know what to do. Where do I begin? Start with a stabilized retinol. So if you already have a routine you like, absolutely stick with it. Just make sure you're using a stabilized retinol somewhere in that routine.
Okay. Let's see. Is it really possible to use just one eye product and one face product and get great results?
Look at me. I only use, I keep the simplest regime ever. Listen, I'm a busy guy. I have a brand new baby. He's almost a year old. I have so much going on in my life that I keep my routine incredibly simple. I use the Neutrogena men's line sunscreen every single day before I go out the door. I try to reapply that once a day if I'm going to go outside at all. If not, I can't. And at night, it takes me about 30 seconds. Quick cleaning and then stabilized retinol every single night. Pearl-sized amount, tiny little bit. It's so easy to do. There's no reason you shouldn't do it. And the last thing I'll leave you with is this is a fight. This is an active fight against the aging process. Some people don't want to fight. Some people are very comfortable with aging gracefully. That's not me. I think this is an active fight. I want to be in the front lines. I'm in the trenches in this battle, and it's very important that you arm yourself with the right information so you can go into this fight prepared.
I agree. I'm right there with you. So that's actually all we have time for, unfortunately. If we didn't have a chance to get to your question, starting tomorrow you can log on to totalbeauty.com and there will be a special dedicated portion of the website where you can ask your questions and then Neutrogena experts will try to answer as many of them as possible. And also, once you have a chance to try the new Neutrogena retinol product for yourself, please log on to totalbeauty.com and update your review so you can share your experience with other women who are concerned with anti-aging. Thank you so much, Dr. Kirby.
Oh, the pleasure's all mine, and I'm passionate about skin, so I hope that came through, and I hope people got a great education about the aging process.
And thanks for watching.
Thank you.